Welcome back. On reflection of World AIDS Day, we have the opportunity to engage this evening with Mr. Nangombe, the Executive Director of the Ministry of Health and Social Services. Now, December 1st serves as a crucial reminder of the ongoing battle against HIV and AIDS. We highlight Namibia's significant achievement in this area and its strategy focused on eliminating mother-to-child transmission of HIV. Namibia has made remarkable progress, becoming a beacon of hope within the region. Mr. Nangombe now joins us on the line. Sir, good evening. Thank you so much for joining us here on the Daily Roundup.
Good evening, Nina. How are you? It's a pity I can't make it to the studio.
Yes, it's okay. We forgive you this time. How are you this evening, sir?
I'm doing well. Thank you very much. How are you?
I'm fantastic. Cannot complain at all.
Right.
Mr. Nangombe, let's talk about, Namibia's current strategies when it comes to combating HIV and AIDS.
Yeah, no, thank you very much. Yes, the country has a very comprehensive set of interventions and strategies to combat HIV. We have been implementing the HIV case finding interventions. This has evolved over the years from mass testing to provider-initiated counseling and testing. And this has actually allowed us to come to a situation where the positivity yield has decreased over the years. We also conduct activities such as HIV recency testing to diagnose new HIV infections that are acquired in the past 12 months. This allows us to identify hotspots and come up with targeted interventions. We have programs such as HIV combination prevention strategy. This is a comprehensive approach that employs a number of interventions, both behavioral and structural, and this reduces the rate of HIV transmission. It combines antiretroviral therapy to suppress the viral load. It includes condom distribution and promotion. It includes the use of pre-exposure prophylaxis, post-exposure prophylaxis, voluntary medical male circumcision, and other interventions. We have also introduced, of course, antiretroviral therapy, ART, where we have even gone to the extent of making sure that people with chronic conditions are able to access this therapy for the purposes of reducing the viral load in our citizens living with HIV/AIDS. Other interventions include the differentiated service delivery models, which has shifted the care from facilities to community-based HIV services. And again, this intervention has also shown us and brought us good results in the national HIV/AIDS response. This is added to the Namibian adolescent treatment support, where the young people living with HIV are encouraged to talk about their status, are encouraged to remain on treatment, and are encouraged to live responsible lives so that they are not reinfected with HIV.
In terms of mother-to-child transmission of HIV, talk to us about the milestones that Namibia has achieved, around this.
Yeah, we have made very good progress. Actually, Namibia is a trailblazer in the region and on the continent. With respect to the prevention of mother-to-child transmission of HIV, we have seen significant reductions. In 2012, the infection rate stood at about 13.4%. By 2021, it has reduced to about 3.8%. And Namibia was in fact declared by the WHO to be on the path towards elimination of mother-to-child transmission of HIV. And we were actually awarded a prize for that reason. And currently, all the babies born to HIV-positive mothers, 99% of them are HIV negative. And this speaks to the success that the country has achieved in this area.
Mr. Nangombe, what role does, community engagement play in Namibia's HIV response?
We believe that community involvement is actually the cornerstone in the prevention of HIV, of fighting the HIV pandemic. Communities play a very important roles in terms of promoting prevention, in terms of public education and information sharing, in terms of support systems, in terms of advocacy through information sharing, and the active participation in the various campaigns that the ministry is implementing. So, for example, we know that when we have a situation where the viral load among those living with HIV is suppressed and it becomes undetectable, it would mean that undetectable equals untransmissible. So this leads to the prevention of the spread of the virus to other people. And we have HIV combination prevention campaigns and peer education and such similar interventions. We also have community health workers who we are actually retraining. In the past, the community health workers used to be either for HIV or malaria or TB. We have now changed the curriculum so that our healthcare workers are able to speak to our communities about issues of nutrition, for example, because for you to have efficacy of the medication that you are taking, you need to have proper nutrition. So we are retraining the community healthcare workers to be able to teach the communities about these activities, and we believe that this is going to make a big difference also within the national HIV interventions and implementation of our activities.
Now, we know that women, Mr. Nangombe, are disproportionately affected by HIV. So, how does Namibia go about, addressing this challenge?
Yes, indeed, women are indeed at risk for HIV infection. It is for this reason that the women who visit our facilities are provided with services such as antenatal care, postnatal care, family planning, cervical cancer screening, and the immunization of their children. These services are provided at the point of care, and the integrated HIV services are also part of this package. So we are addressing and targeting adolescent girls and young women to ensure that they are provided with correct information to be able to protect themselves. We know that the sugar daddy phenomenon is real, and we need to empower our girls to make the right decisions so that they are not infected. And where, for example, in sexual encounter takes place, and perhaps the person is not so sure about the status of the other person, we do offer pre-exposure or post-exposure prophylaxis for those individuals just to make sure that they are protected.
Now, we know that World AIDS Day is usually commemorated on the 1st of December annually. This year, though, Mr. Nangombe, Namibia has shifted the commemoration date. Just talk to us about that and the reasons behind the decision.
No, yes, we normally December 1 is the commemoration of World AIDS Day, but due to factors that were beyond our control, we decided to postpone the commemoration to the 13th of December. This is going to take place in Rundu in Kavango East. We are inviting members of the public to join this important event. It is going to comprise a number of activities, including a keynote address by the Minister of Health and Social Services, Dr. Kalumbi Shangula, where he is going to address the nation and share with them the information about our national response to HIV epidemic. We are going to have our development cooperation partners taking place. We are going to have community members also taking place. We are going to have people with lived experiences also providing their own testimony so that we can fight the stigma of HIV. People need to know that HIV is not a death sentence. It's a disease that can be managed. We have effective treatment, and the people who are taking their ARVs can lead normal, productive lives. The situation is no longer the same as it used to be in the late 90s and the early 2000s, when our health facilities were strewn with sick people, where we were burying people almost every weekend. The situation has changed. Namibia is on a trajectory to end AIDS as a public health threat by 2030. We have implemented very ambitious targets to achieve 97 on the UNAIDS cascade, so that we are on the path to ending HIV/AIDS as a public health threat. So it is up to all of us to come forward to do our part to make sure that we break the backbone of HIV/AIDS in our country.
Mr. Nangombe, always lovely speaking to you. Thank you so much for joining us this evening.
Thank you, Nina. It was a pleasure talking to you. Good night.
That was the Executive Director of the Ministry of Health and Social Services, Mr. Nangombe, speaking to us as we reflect on World AIDS Day. It's almost time to say goodbye. We'll be right back.